Okay, so axial skeleton. One thing you want to recognize here when we talk axial skeleton, we are looking at literally the cranium, okay? We're looking at the vertebral column, we're looking at the thoracic cage, so what we consider the rib cage. So those are the three features we're focusing on the axial skeleton. Now, when we look at the skull, the big thing I want you to recognize about the skull is we break the skull, the whole area, into two parts. We have the cranium, okay, the top of the skull, the part that is protecting the brain, both internal bones and the external bones that we're used to dealing with, and the facial bones. Okay, so now what we're going to do is, as we go through this, you want to make sure you recognize the different cranial bones in all three views. You want to be able to recognize them from this interior view inside, okay, where we look at key bones besides the frontal, okay, the parietal, and the occipital, which, by the way, the occipital is also this part that goes to the greater foramen. Okay, you also have these bones on the inside. Okay, you can see the sphenoid, which surrounds the sella turcica. The sella turcica is this place where you can really put your finger in, and then you have this area up here, which is part of the ethmoid. So those are the two bones that are part of the interior. We only see them on the interior of the skull. Okay, when we look at those. Now, the skull, the facial bones. Okay, the facial bones are highly complex. You see a lot of key features. There's a bunch of facial bones. Okay, the ones that are not paired are the mandible, which, by the way, is the only free-moving joint, and then the vomer, which you can see from the inferior view. So what you want to make sure you're doing is connecting the different views of the skull and looking at them and making that connection between where the frontal bone is on the anterior view, where the frontal bone is on the lateral view, and obviously you can't see the frontal bone here because it's above all of these parts of the facial bone, but you want to start making that connection between all those bone parts. Now, when we look at the skull, one of the things you want to recognize is when we look at a fetal bone, when we look at the fetus, okay, and you see what we consider the soft spots, all of these areas that have to grow together. We see that here in terms of where the bones are going to fuse. So you can see that here we have the frontal bone fusing with the two parietals. All of these areas here, okay, are basically where we see the soft spots. And so what happens is we have a couple of reasons for this. Obviously, but the baby has to get through the facial, has to get through the birth canal, and it also gives room for the brain to grow. Keeping in mind the brain has to remain attached interiorly so that it holds, because we don't want, okay, if you look at, and this represents my spinal cord, I want that brain attached so that this thing isn't moving against this hard surface, because then it'll damage. This is soft tissue compared to the skull. Well, when we look at the bone of a baby, it has to be able to be compressed without moving the location of those structures interiorly. So it has to be compressed so that it can fit through the birth canal. We also see, that's also the reason that we see this reduced facial. So if you look at you can see that the facial bones are much reduced in terms of size and features. Now, we talked about this in class. When you look at the bones, they're much heavier than they should be. You need to recognize we have four basic areas for sinuses, and the point of the sinuses is to lighten the skull and give resonance. So we literally have some right here in the frontal bone, the frontal sinus coming right here in this area. You have maxillary, so that's going to be up in this area here. We actually have sinuses in the maxillary region. Okay, we have sphenoid sinuses. Now look at the sphenoid. Going back, remember that the sphenoid's all over. So when you look at this, these are part of the sphenoid. We have sinuses in that area to help lighten it. And then we also have an ethmoid sinus. Now the ethmoid, again, was what you could see in this area here. So there's sinuses in that area, and it helps to give resonance to the voice. It helps to lighten the skull, so the skull is more doable. Lighter, does what it needs to do without breaking us down. The big thing that you need to know about the hyoid is what is the only bone that doesn't articulate with any other bones. It's strictly held in place by muscles. It's associated with the anchoring our tongue muscles and helping support the trachea so we can breathe. Now, the vertebral column. The vertebral column has a couple of functions. Obviously, it's going to protect the spinal cord. Okay, so when the spinal cord exits the brain, okay, through the foramen magnum, okay, it's going to come down here. We have to have protection as it comes down through the body. If anything happens to the brain, the spinal cord, we know bad things happen to the body. you can see that there's a couple of curves. We have an anterior curve at the cervical spine, we have an anterior curve at the lumbar spine, we have a posterior curve at the thoracic vertebrae, and that's real important in terms of functions. We give space in the thoracic region, which is kind of important. That's where our heart and lungs are. And we also see that this curve is going to help distribute weight, which is one of the major functions of the vertebral column. Now, key features. Every vertebra has these key features. You can see the lamina here, okay, surrounding the lamina, and the pedicles surround what's known as the vertebral foramen. The vertebral foramen is that hole, that gap, where we know the spinal cord is going to be traveling down from the top of from our head down to our low back. Now, the other thing is we have what's known as a transverse process. Okay, that's literally these things that stick out the side, and we have the spinous process, the part sticking out the back. Now, what we see is as we move down the spine, there's some key features between all of the vertebrae, starting with the cervical. When we look at the cervical, we talked about it in class. You have, in essence, you can see the three holes. Okay, you can see the spinous process, you can see the vertebral foramen, and then we have that other thing, we see this bifid spinous process. So those are some of the key features of it. Notice also the body is very small because we're not supporting a lot of weight. Okay, now the two cervical vertebrae that you do have to know obviously are C1 and C2, axis and atlas. You can see how they fit together. Remember from Greek mythology, Atlas supports the world. Well, our atlas is what supports, okay, our skull. So you can see how I have this motion and it helps to support it. So we have these condyles on our occipital bone that are going to articulate with atlas. Now, atlas can then rotate around the dens of the axis as I drop this ribs. Okay, so we have the dens here, you can see that, and this literally fits around it, and this is what allows us to do that rotation motion where we can turn our heads left to right, that no motion. Okay, there's a ligament that helps to hold this in place. Okay, and in babies that ligament's not fully formed, and it's this movement that is responsible for the shaken baby deaths. Okay, where that dens can damage things as it goes through. The thing to remember about the dens is if you notice, atlas has no body as we traditionally see bodies. What literally happens is the body of atlas is actually fuses with axis, and it's the dens. The dens is what was formerly the body of atlas, and you can see that articulation point and how those fit together. Okay, as we move down to the thoracic vertebrae, the thoracic vertebrae have some key features as well. Primarily, we see that posterior curve here, and that's to make room. In addition, we see a couple of things. We see these pointed processes. We see the spinous processes begin kind of going in a downward fashion. We also see the transverse processes have articulation joints. And the reason we need that articulation point is because of the ribs. So you can literally see the rib is going to articulate with both a little bit of the body and with that transverse process. So that's why we have articulation points in the transverse process, as well as the articulation processes with the other vertebrae that would occur, the anterior and superior articulation processes. Okay, now the reason we care about that, kind of jump ahead a little bit, is because of the thoracic cage. Keep in mind that the ribs have to work together with this to create that thoracic cage. Now the lumbar, okay, obviously we see that change as we move down. So the lumbar, the body is much thicker, much broader, much more intense. The vertebral foramen gets a little smaller. We see just in general it becomes more massive because it's responsible for carrying more and more weight. So you can see that we're increasing in size. You can see how the articulating processes change in terms of orientation. Lastly, we get to the sacrum. The sacrum again is in essence 5 fused vertebrae. Okay, you can see these holes here, which would in essence be the spaces between the vertebrae. You can see that it's going to in essence be almost a fused joint with our coxal bones. Again, the whole thing is to get all of the weight to this point where it can get transferred out to the coxal bones and then send all that weight down to our feet. A couple of features you can't see on this that you can see on the picture is what's known as the sacral canal here. What happens is our vertebral column comes through here, Okay, and it comes out and it's actually anchored down here with a piece of connective tissue. And that hiatus area is the last plate. We see the horse's tail in essence in this area. That's what we call that area of the spinal cord. Now when we get here to the bony thorax again, we're looking at the cage to protect the major organs. Okay, again, remember we have that posterior view to make room. Okay, and when you look at the sacrum, okay, here's the jugular notch, which you can feel right here on you between your clavicles. Okay, so you have that jugular notch right here. And then this is what's known as the manubrium. You come down into the body of the sacrum. Okay, and then we end up with the xiphoid process. The xiphoid process is the thing you have to be wary of when you give CPR, because you can actually send the xiphoid process into the internal organs below and literally cut them, slice them, be bad. So you have to make sure you know what you're doing whenever you do CPR. Okay. So when we look at the ribs, we have 12 pairs of ribs. You can see how they would, here you can see that articulation with the body and with the transverse process. Okay. And that's what helps to join the ribs with the rest of the sternum so that you can come around. The sternal joint is oftentimes, you can see here we have some cartilage here. Depending upon the location, okay, it's going to, you'll see more cartilage or not. So these first ones are known as the real ribs. The first 7 consist of real ribs. The rest are considered floating or false ribs because they all join this common area of all of this here. They're kind of sharing cartilage to join to the sternum. And then we have the floating ribs, which don't attach at all. And you can see that when you look at the skeleton. We'll talk tomorrow if you have any other questions.